The January issue of Respiratory Care included the paper entitled Pediatric Tracheostomy Care Simulation, Real-Life Scenarios in a Safe Learning Environment, authored by Jennifer McCoy and colleagues. My name is Denise Willis, and this video abstract includes a discussion on this paper. I'm a respiratory therapist at Arkansas Children's Hospital and also a section editor for the Respiratory Care Journal. Children with a tracheostomy are a medically fragile, high-risk population as they require continuous care by a trained caregiver. Before discharging home with a newly placed tracheostomy, caregivers must undergo extensive training to learn all of the skills required to care for their child at home and be able to demonstrate routine care. Emergency scenarios are often only discussed, and caregivers may not encounter tracheostomy-related emergencies with their child until after they are home. Simulation can provide a realistic experience to better prepare caregivers for tracheostomy emergencies. The objectives of this study were to improve caregiver competency and comfort, decrease tracheostomy-related morbidity and mortality, and to decrease ED visits and readmissions. 4 emergency scenarios were created, including a plugged tracheostomy tube, accidental decannulation, cardiac arrest, and ventilator failure. A high-fidelity mannequin was modified with a tracheostomy and programmed to breathe spontaneously and show cyanosis. A monitor displayed vitals, including pulse oximetry, and was equipped with a pulse oximetry alarm. The simulated environment was set up to resemble the child's bedroom and also included a ventilator. The session lasted approximately 1 hour and included a pre-simulation questionnaire, each of the 4 scenarios, a post-questionnaire, and debriefing. The questionnaire assessed caregiver knowledge, confidence, and comfort using a 5-point Likert scale of agreement. Medical records of the children whose caregivers completed simulation were reviewed 90 days after discharge to assess for complications. The statistical analyses included descriptive statistics and Wilcoxon-signed rank tests for continuous data. The study included 18 caregivers of 10 children. The majority of children had 2 caregivers, were female, of the white race, and were premature. The median age at tracheostomy placement was 4 months of age, and all children included had a trach placement in 2019 or 2020. Caregiver scores were increased by 9.1% in agreement from pre to post simulation, and each domain for knowledge, confidence, and comfort were all significantly increased. Records were reviewed for 9 of the children. 6 had at least 1 ED visit within 90 days of discharge, of whom 4 required admission. 2 had ED visits but were not admitted, and 1 other was admitted without an ED visit, but none of the ED visits or readmissions were for tracheostomy emergencies that were covered in the simulation session. Simulated tracheostomy emergencies allows caregivers to respond to these situations in a controlled and low-stress environment. The sessions were not designed to be pass or fail, but rather provide caregivers with a realistic experience. Debriefing is a vital part of simulation, as this step helps caregivers learn and understand the results of each emergency scenario. Some of the study limitations were that at the time of the study there was not a commercially available pediatric mannequin that could accommodate a tracheostomy, so the mannequin used in the study had to be modified with a custom-made trachea and tracheostomy. The mannequin was light-skinned, and this may have impacted minority caregivers, and the sample size was small as the program had to be temporarily suspended due to the COVID-19 pandemic. In conclusion, high-fidelity simulation of tracheostomy emergencies provides caregivers with a more realistic experience in responding to emergency scenarios. In this study, simulation led to improvements in caregivers' self-perceived knowledge, comfort, and confidence in handling tracheostomy-related emergencies. Thank you for your time. Be sure to follow the journal on any of our social media sites to receive updates and new content.